Disproportionately, when we're talking about essential workers, we're talking about women of color.
The amount of stress that these pandemics have put on women healthcare workers is kind of unfathomable.
And so this intersection of race and gender, intersectionality, as Kimberly Crenshaw calls it, results in a disproportionate impact on women, particularly women of color and Black women within the criminal legal system.
My name's Terry McGovern. I'm a human rights lawyer. I'm currently the chair of the Heilbronn Department of Population and Family Health, and I am also the director of a program called Global Health Justice and Governance. I spent many years as a human rights lawyer. I started out working with women with HIV, and I pretty much learned about intersectionality and racism and pandemics within pandemics as a lawyer in the 80s. I was just a poverty lawyer in New York City and started to see all these women coming in who were HIV positive but never got AIDS. I was seeing women of color, primarily, mostly Black and Latinx women coming in who actually were getting sicker and sicker, losing their kids because they couldn't pay their rent, so their children were being removed because they were seen as non-suitable, and ended up understanding that the public health authorities had overlooked this whole issue of converging epidemics. So they had overlooked that women would have different symptoms in the face of being immunocompromised, and they overlooked that, you know, communities that lived in houses where there was overcrowding, lack of cleanliness, lots of mold due to the, you know, poor services people were receiving, you'd see more bacterial pneumonia, you'd see more tuberculosis, you would see certain diseases that would, of course, be more pronounced and more deadly in the face of immunocompromise. So I sadly was very familiar with the concept of kind of intersectional impacts and a government that really responded to the version of the white male patient. From the very beginning, I was very worried about COVID. I was worried about any kind of statements that young people were not at risk, that just elderly people were at risk, that women weren't at risk, that, you know, it was primarily going to hit XYZ group. I knew from my HIV experience that it was going to sadly hit communities that were already burdened by environmental injustice, cardiovascular disease, heart disease. I sadly was not surprised at all when the patterns began to emerge that it was disproportionately killing people of color. Frankly, our public health authorities should have known this. We should know a lot more about how to respond to pandemics. We should know it from HIV. We should know from Ebola. We should know from, particularly, we've learned a lot from epidemics or pandemics that require quarantine. And I just rarely saw, except in the case of a few extraordinary leaders who were really applying an intersectional policy lens, we saw very little usage of lessons learned. In New York City, we've basically been watching our white male mayor fighting with our, you know, white male governor. I've noticed that some of the most incredible, our commissioner of health is a woman of color, New York City commissioner of health, and, you know, somehow she's rarely been front and center. So it's been very interesting to watch the kind of dynamics in many places. Have been examples of women who actually are doing a better job emerging around the world. But I do think we all have to interrogate what is going on that competent women get pushed aside in some instances. We knew from Ebola that if you impose quarantine, domestic violence rates are going to go way up, not just for women, but for children. And we have, really serious, horrifying evidence from Argentina, Mexico, um, China, the US. I mean, pretty much everywhere we saw spikes in gender-based violence. We've spent a lot of time figuring out how to prevent gender-based violence, including messaging to men and boys. Um, and I didn't see much evidence of any of that being utilized. And when we think about response to a pandemic or disaster response, why have we still not learned how to integrate all the knowledge that has been accrued about, kind of preventing and addressing violence? Of course, the other issue here around women is, 1 in 3 jobs globally, I think, that are deemed essential are held by women. So you have women at risk, then you have women as the primary caregivers in many instances in the home, undervalued, unpaid. In places where children are home from school, women are, triply burdened by having to care for usually, the children. So vast issues around care and a disproportionate impact on women. You have this weird intersection of women being at highest risk as essential workers, and then women being really bearing the burden at home. And there's been a few studies in the academic context of women being much less productive during the quarantine periods, which of course makes total sense, right? Because they're taking care of everybody. But when you think about why aren't we seeing women in leadership positions, or why is most of the public health leadership still male globally? These are the kind of factors that are contributing to this, that women are taking care of people all the time and are vastly affected when there's a quarantine, when there's a health crisis. Or the other big piece of this is, which relates to the domestic violence and relates to the caretaking role and how women are sidetracked in an epidemic, is sexual and reproductive health services. So when all the countries started realizing we have to divert resources to COVID, in many places, including the US, lots of folks who really don't believe that women should have access to sexual and reproductive health services seized the opportunity. Policymakers attempted to claim that abortion services, but even sexual and reproductive health services, are not essential. And a lot of clinics that dealt with sexual and reproductive health services or domestic violence were shut down. In the US, we had litigation around the abortion, pretty much successful litigation, but in lots of places around the world, the clinics were just shut and remain shut in some places. This is going to lead to all kinds of disastrous health consequences for some men too, but primarily for women. We saw in Ebola, when women lacked access to essential sexual and reproductive health services, you saw spikes in maternal mortality, in all kinds of sexually transmitted diseases, in, even screening around reproductive cancers. On the one hand, we know women are the essential workers and they have to take care of a lot of people. And then on the other hand, we see they're kind of devalued when people are making decisions about what's essential. We're disproportionately, when we're talking about essential workers, we're talking about women of color. So yes, more women of color at risk as essential workers. Then, of course, we have more women of color as heads of household. And so the economic impacts, if they don't do essential work, right, are huge. All of these impacts we're describing, like maternal mortality or lack of access to sexual and reproductive health services, we already have, huge disparities in maternal mortality affecting Black women. The United States has an outrageously bad record around maternal mortality in Black women. In almost every category, you have disparities where Black and Latinx women are disproportionately impacted. things like cervical cancer, which are totally preventable and treatable. So you lay this pandemic on top of that, things are worse. And we know that it's disproportionately impacting, communities of color. So really bad, converging intersectional impacts. The same is going on around unpaid labor, paid labor, and care. There's, you see women bearing the disproportionate burden of all of it, right? Being, if they are essential workers, really also having to take care of the family at the same time. And then we have this whole other layer around kind of access to services. The numbers of women in prison are really, really high. The services are totally inadequate. There's obviously not, people are not being kept safe. We have homeless women who are disproportionately also tend to be women of color. So as you kind of go through the populations, you continue to see these converging impacts in ways that are very disturbing and rarely addressed. Women who are in prison tend to be in prison for kind of economic survival crimes. That was my overwhelming, many of the clients I've worked with through the years had been incarcerated, and most of them were in prison for survival crimes. And it's very interesting because in prison, women create communities, they educate each other. The first people to really talk about how women were being differently affected by HIV were women in prison. Um, but so in COVID, I just think, like as in every other context, moves were not made quickly enough to provide for the distancing, to provide for the care that people were sick. I think that, we have the same issues around people in detention, right? There's such a problematic situation globally around migration and the criminalization of people on the move. And I think, again, not enough care or thought to protecting people. All of the hysteria around, which is not based on facts, that migrants are bringing disease, that we can't let people into the US now because of the pandemic. We don't do the basic things that would prevent people on the move from getting COVID, right? So it's all terribly contradictory, and people's human rights are being violated left and right. So it's and there's so much more that could be done that wouldn't cost a lot. So it's very disturbing. The fact that women do so much unpaid labor is one of the essential reasons that women still kind of across the board, even if you look at the SDGs or the Millennium Development Goals, still are not in any way, shape, or form equal. In the context of environmental degradation or environmental emergencies, it's the same, right? Where people have to flee, any kind of political persecution, you always have women really doing all this unpaid labor and hampered in various ways by that. I think there have been advocates around the world pushing and analyzing the actual value of all this unpaid labor. But I think, again, you don't hear much talking about this from the leaders during the pandemic. We have an acknowledgement, kind of people laugh. I know some of you have kids at home and you see women on calls and there's kids pulling their hair, and you see the elderly parent walking by. And so people say, oh, I know it's way worse, but what are we doing for real? We need to do more than talk about this. We need policies that are going to begin to address these things. And we certainly need to use kind of the impacts of this pandemic to highlight how obscenely unjust this unpaid labor is. I'm very excited by what's happening because, first of all, as opposed to in the HIV days, we now have the capacity to communicate around the world kind of instantly. As the COVID pandemic unfolded and all of these gender-based crises started emerging, we were able to share information as we went. In terms of kind of organizing, and social media has some problems, but it also makes it a lot easier. There's a lot of tools where we can talk to each other a lot more quickly. Now, in terms of the kind of intersectional leadership, at least in the US, I think that what we're really seeing finally is the calling out of white supremacy in a way that in my lifetime I have not seen happen. So it's tremendously exciting. And of course, it's due to the incredible leadership of Black women, women of color. It's exactly what I've been saying. If women of color, Black women had been in charge in response to this pandemic, we would have seen much smarter responses. And that is white supremacy right there. That is white supremacy, that there are incredibly capable women of color who should be leading the response, and somehow they're not. And the brilliance of white supremacy is to make people feel like they're inadequate, people of color, that it's not the institutions, that it's them. But what we're seeing, which is so exciting, is all of these young people of color saying no, no, it's enough now. And so in my environment at Columbia University, our Black and Latinx students made a set of amazing demands. They're like, no, we don't want one class on social determinants of health. We don't want to read, the land statement, this is the land of the Native Americans. We want in every class the intersectional analysis around social determinants of health. We want to break down why it is so difficult to quote unquote recruit faculty of color. I am very hopeful. I am very, very hopeful because basically I feel like the game is being called now. And I've never seen that on such a big level. And I could tell you that these very same students who are making these demands of Columbia University, and well, they should, will be much better leaders. They will lead us to a much better place than our current leaders. And they will do these things we're talking about. So that's all tremendously hopeful for me. I'm hoping that that we're in the last gasp of the ugliest form of white supremacy in this moment, and I can't help but be inspired by the bravery and the creativity and the really straight talking from all these incredible activists all over the place. So that's hopeful.